there, it's Todd Smith coming to you from Queen's Park in Toronto, and it's early March, and I'm glad to say that pretty much everything is open across the Quinte region. Of course, our businesses were reopened in February, and the schools were reopened in January, and thanks to the good work of everybody in the Bay of Quinte region, we continue to be in the green zone, which means our businesses can operate almost as if things were normal. Of course, you have to continue to wear a mask, you have to wash your hands often, and try and stay 6 feet apart or 2 meters apart as much as we possibly can. But we really want to stay in that green zone. So it's up to all of you to make sure that you're following those health guidelines so that we can stay in business and keep our kids in school across the Quinte region, which I know is so important to everybody out there. At the same time, business supports are still available for any of our small businesses that were shut down during the lockdown. There's been a huge uptake on all of those businesses, business support programs, I should say. And I believe we are almost at $1 billion that has been put out now by the provincial government in the Ontario Small Business Support Grant. And for all of the supports that you need, just go to ontario.ca and you'll find them under the business supports part of our COVID supports response. Vaccinations are rolling out. Boy, they've been slow coming from the federal government, but now that we have them, another vaccination has been approved by Health Canada, which is going to help us in the distribution of vaccines right across Bay of Quinte and right across Ontario. We've been able to get all of the long-term care homes, their dosages, and as a result, we've seen a real downturn in the number of outbreaks at long-term care facilities. So it was a really wise decision on behalf of public health and the government to make sure that we looked after those long-term care facilities first. And so we've saved hundreds of lives, in the words of the doctors who have been advising the government, by making sure that we were getting out to long-term care first and vaccinating all of those vulnerable people in those facilities. Frontline staff are now being done, and you've probably seen through local media that Quinte Healthcare frontline workers are also getting vaccinations now. We have a regional immunization center that's up and running as of March the 1st at Loyalist College. So thanks to Dr. Anne-Marie Vaughn and the whole team there at Loyalist College for really stepping up and helping local public health officials and providing that regional immunization center for the region. And we are part of a pilot as well in Hastings and Prince Edward. When it comes to registering for the vaccine, there are 6 different health units across the province that have been identified for this early pilot project, where those who are 80 plus are being registered, and 80 plus, I mean 80 years of age and older, are being registered. And it's almost like a soft launch of the province-wide immunization registry. So I know in talking with Dr. Peter Oglaza, our local medical officer of health at the Hastings and Prince Edward Health Unit, we've been working with our family physicians and others to populate that list, which has gone into that central registry, and those individuals will be getting informed as to when they can go and get their vaccination, as more and more vaccinations are starting to pour into the region. And as I mentioned, with more types of vaccines available, at first you'll recall it was the Pfizer vaccine, which had to be stored at -80 Celsius. The science has evolved on how to store that over the last number of months that it's been in circulation. And now we're able to move that a little easier than we were in the beginning. The Moderna vaccine is also one of the ones that we've received the most dosages of, and it's able to move a little bit easier than the Pfizer one. And now we have a couple of others, Astrazeneca, which has just been announced as of last week. It will be arriving in Canada later this week. And then Johnson & Johnson has been approved in the United States, and it's believed will be also getting the green light from Health Canada very soon. And that one's really, really easy to use. It doesn't have to be stored at any special temperatures, just in a regular fridge, and it just requires 1 dose, which I think is going to make life a heck of a lot easier for individuals that are immunizing across the province, and those who are receiving it as well. No second dosage is necessary for the Johnson & Johnson vaccine. Over the last little while, we've had a number of very, very important announcements. One of them was a $6 million announcement with our colleagues at Hastings County Emergency Services. So Hastings Quinte EMS, and that's Doug Saka, who's the chief paramedic there. Daryl Cramp, my colleague from Hastings, Lennox, and Addington, and I were able to announce that $6 million in funding for the expansion of the community paramedicine program, specifically aimed at those who could potentially be in long-term care facilities and getting them treatment at home. So this is really important right now while there are so many fragile individuals who are waiting for spaces in long-term care, but still living at home where really they want to be. These community paramedics will be coming in and offering care to individuals in their own homes. So this was a really, really great pilot project that was running in Hastings County for the last 5 years or so. And now we've been able to expand it to include Hastings and Prince Edward counties. And I know Chief Saka was really excited about that, and the local paramedics. And certainly our elected officials from Prince Edward County were really excited to be a part of that program as well. So watch for the community paramedics. They've been doing amazing work throughout this pandemic. Our local paramedics especially, they were the first ones doing this work. As you'll recall, we were the community that welcomed the folks from Wuhan, China, the Canadians who were living there back at CFB Trenton in early February of 2020. And those paramedics have been on the job since then and doing great work. Another really important topic that's been getting a lot of attention is sick leave. And sick days being available for individuals out there. And I'm really pleased to say that late last year, the premiers and the Prime Minister came to an agreement that the sick leave would be provided through the federal government. One of the things that we've tried to accomplish throughout this pandemic with my colleagues at Queen's Park who sit around the cabinet table and those on Parliament Hill and our partners in the municipal sector as well, is to not duplicate programs. So we came to an agreement on sick days where the federal government would be responsible for providing the paid sick leave. And originally the agreement was $1.1 billion for the entire country. And it was to provide up to 10 sick days per individual. With a lot of these programs, we've worked together to make them more nimble, to get the money into the bank account quicker. But we've also expanded this program. So it's now 20 paid sick days, or a full month's pay, if you want to look at it that way, for individuals who may need to take that time off as it relates to COVID-19. So there's $1.1 billion in that fund. As of about a couple of weeks ago, there was still upwards of $800 million available. So that means there are sick days there if you need them for your family, and pleased with the partnership that we have with the federal government on providing those sick days. We've also been able to make a really cool announcement in Hastings and Prince Edward counties with addictions and mental health. And it was a $1.4 million announcement that we made last week that has to do with addictions and mental health counselors and our local police services and Quinte Healthcare. This is something that we've been talking about for a long, long time. Local police officers, and dating back to when Corey McMullen was the chief of police in Belleville, she was raising this with me. Too often, our police officers are dealing with mental health cases. Upwards of 40 to 50% of the calls that they respond to every day were mental health cases. What this program, it's called Impact, is going to do is have mental health counselors available to work alongside Belleville and OPP officers in our local region, so that if it is a mental health case, there will be a trained professional there. Not to say that police officers aren't trained in these types of calls, but they're not trained to the extent that these mental health counselors will be. And should they require treatment, Quinte Healthcare is also a partner in this program. The mental health counselors will be the ones staying with the individual at the hospital during that stay, instead of taking a police officer off the street. So it's a great program, $1.4 million that we were able to announce with addictions and mental health last week. Also, Loyalist College is receiving $316,000 from Ontario Colleges and Universities Ministry for mental health counseling as well, because we know our post-secondary students and those in elementary and secondary school have been having a tough time with mental health, as most of us have during the pandemic. So that extra funding is going to Loyalist College as well. We've also been able to announce some restart funding for our local municipalities, upwards of $1 million to deal with extra costs that municipalities are bearing when they provide transit services as well. We know that the transit services in our region have been hard hit. There's not as many people traveling on the buses as there normally would be for health and safety reasons. And so to help the municipalities in the lost revenue that they've been experiencing, the provincial government has provided almost $1 million. I believe it's $871,000 for Belleville, upwards of $88,000 for Quinte West, and about $9,000 for Prince Edward County to help out with the losses of revenue in their transit systems. And also a really cool announcement that I was able to make last week on behalf of the Ministry of Agriculture is rural economic development funding. We know when the economy starts to rebound, and it actually is rebounding in our area right now, that there's a great opportunity to link people back to employment. A lot of people have been off the job, but boy, there's a lot of jobs out there, particularly in our manufacturing sector. So the $48,000 in rural economic development, or RED funding, is going to the Quinte Economic Development Commission in working with the manufacturers to profile the different types of factories and manufacturers there are across the Quinte region and highlight all of the really good paying jobs, some of them with benefits, many of them with benefits, that are available to individuals in the Quinte region right now. So that money is going to be put to good use to market those manufacturers, profile them, and link people back to employment as the economy gets back to full speed in Ontario. So it's been a busy couple of weeks, and that's the update from Queen's Park. And I look forward to updating you on new developments as we continue to deal with the COVID-19 pandemic real soon. And stay safe, Bay of Quinte.